Good morning. For today's video, I will demonstrate the emergency management for prolapse of the umbilical cord. First, we need to gather all the items that I need in this procedure.
The rationale for doing this is for easy accessibility for examination of the external genitalia, vagina, and cervix. The next procedure is identify the client, introduce yourself, and explain the procedure. Good morning, ma'am. I am Jomar Vispiras and I will be your nurse for today. I will do internal examination to assess the progress of your labor. The rationale for doing this is to obtain the client cooperation and work simultaneously. Next procedure is position the client on the examination table, and there are three types of employed position for internal examination. There are dorsal recumbent, the Sims position, and niches position.
Ma'am, you will be positioned at the examination table to assess the progress of your labor.
The next procedure is drape the client. Expose only the gynecological area. And the rationale for doing this is to always respect the modesty of the patient and provide privacy. Ma'am, I will put the drape on you and I will expose the part that I will need to examine. The next procedure is wash your hands and put examination gloves. The rationale for doing this is to protect the healthcare provider from contracting gynecological diseases caused by highly infective organisms. Ma'am, I will do hand washing and I will put on my examination gloves for internal examination. After that, I will change into the sterile gloves after I assess the progress of your labor. The next procedure is assess the well-being of pregnant woman. If the cord is visible outside of the vagina or can be felt in the vagina below the presenting part, handle the cord carefully and remember, do not pinch the cord. Ma'am, while I inserting my two fingers, can you take a deep breath while I do internal examination? If I see a cord protruding in the vagina, I will handle it carefully. After performing the internal examination, assess the well-being of the infant or the fetus. Monitor the fetal heart rate using the stethoscope. Now, ma'am, I will assessing the fetal heart rate of the baby by using the stethoscope. If you are in CEMOC facility, report the findings to the obstetrician for emergency cesarean section. The next procedure is assess the patient to do the niches, head tilt, left lateral position, and instruct the mother to take a deep breath and control the urge to bear down. Ma'am, I will assist you in a niches position. Can you take a deep breath, and do not bear down if you have urge to do so. The rationale for doing this is to use the gravity to shift the fetus out to the pelvis. Before doing this procedure, you must put on your sterile gloves. Elevate the presenting part by filling the urinary bladder by inserting a urinary catheter and instruct the client not to bear down. Ma'am, I will insert a urinary catheter that will inflate your bladder with a sterile fluid. It will help to reduce the compression of the prolapse cord. The next procedure is elevate the presenting part by inserting your fingers into the vagina and push the head of the fetus upward. Remember, Do not remove your fingers until you arrive at the delivery room or operating room. Ma'am, I will put my hand glove into your vagina and I will push the head of the baby upward. And take a deep breath when you have the urge to bear down. The rationale for doing this is the elevation of the presenting part is thought to relieve the pressure of the umbilical cord and to prevent the mechanical vascular occlusion. The next procedure is call out the time of birth and gender of the baby.
I will call out the time of birth and the gender of the newborn.
If the baby is in a good cry, I will proceed into the ANC. If it's not crying, I will cut the cord and proceed to resuscitate the baby if needed. The rationale for doing this is to safeguard the mother and the baby against the infection and to facilitate the spontaneous breathing of the infant. The next procedure is remove your gloves and do hand washing. The rationale for doing this is for infection control. After the procedure, I will remove the gloves and do hand washing. The last and final procedure is document the date, time, and the procedure that was done to the patient. Thank you.
After the procedure, I will document the data and time and all the procedures.
The rationale for doing this is to provide accurate data in the care of the client.